Okay, again, welcome folks. This is Dr. David, and our goal with Building Strength webinars is to help people make the most of their minds and their bodies, and we do that by helping them understand how those two work and also help them provide them with the intelligence and the direction needed to regain, maintain, and improve their health. And we have had a lot of help along the way, and we are very, very blessed and feel very grateful to those who have helped us. We have created a series for you, since we're talking about prevention today. We have created a series which we'll make available to you on our site shortly. And like I said, we've been blessed to have a lot of help from very, very qualified people. The top one, Anatomy of a Heart Attack, with Dr. Lundell. By the way, this man has been, for the past 10 years, one of the top 10 doctors in the University of Phoenix. And he has done in excess of 5,000 bypass surgeries. So he's a cardiothoracic surgeon, 5,000 bypass surgeries. And he realized what he was doing as a doctor was not enough. And so he has devoted his life to educating people about heart health and what they need to do to improve the health of their cardiovascular system. And I tell you what, he has a lot to say about health and about cardiovascular health. So that would be a very, very good one to have. Of course, what we've tried to do is that we've looked at the major diseases, the major problems in the country today, heart disease, cancer, stroke, Alzheimer's disease, and what we've done is we've created the series so that it can cover the basics where these are concerned. I just want to point out to Dr. Luna, who is a dentist, and he, according to the University of Cambridge, is one of the top 2,000 healthcare professionals in the world. Now, when you take a look at him, you don't think he would be such, but because he looks very, very young, but he's a very, very, very accomplished scientist. And so we were making these available to you. Just go to our site whenever you get the chance to. I don't want to take too much time from our presenters. So, like I mentioned today, we have two presenters today. We're going to start with Steve Dodder. And I'm going to read his bio and in a short time hand this over to him. Steve Dodder is co-founder of the Colorado Society for Wellness and Prevention, and that his website is coloradowellness.org, and he currently serves on their board of directors. In 2004, Steve and his wife Nancy became business development partners in my EPHIT, and that's stands for Electronic Personal Health Improvement Training, and grew it to a 25+ million member online fitness, nutrition, and life skills management program. Wow. Steve and Nancy then co-founded My Wellness Choice Plus in order to provide low-cost, high-value wellness solutions to individuals and employee groups of 2 or more. He also has a couple of other things that he is really, really involved in, but obviously the Colorado Society for Wellness and Prevention is his baby, and that is what his passion is. So without much further ado, I'm just going to hand this over to Steve. Steve, thank you so much for taking the time to do this, and I'm going to hand this over to you.
Great. Thank you, Doctor. Get this going here. Well, good day. I'd like to just say it's a privilege to be able to present to you today, and I thank Dr. David and glad that Dr. Ron could join us. I wanted to take just a few minutes of time today to present to you what we have created in Colorado, which could be a model organization for other states, and also how we were involved in model legislation to improve the health and well-being of nearly all of the individuals in Colorado. It's quite a paradigm shift for Colorado that we started as of last July. Let's see if I can get this to advance. Here's my information in case you have any questions afterwards. The easiest one to remember is my email address, and it's simply steve@coloradowellness.org. So please reach out to me if you have any questions. Briefly, the Colorado Society for Wellness and Prevention we are a membership based organization. We are filed as a 501c membership-based organization, and we are also working on establishing a not-for-profit 501c3 arm. We founded our organization in April of 2009, and we had our first public meeting when we did our rollout at National Jewish Medical in Denver in December of 2009. Currently, this is a pretty good summary of our member list. You can see that we're kind of a small organization, but we have some great organizations and individuals that have joined us. We're actually, considering our size, we are a high impact organization. We have 3 of the largest, most respected hospitals in the nation as memberships, and on our board we have the 9 Health Fair, which is the largest health fair in the country. We have the Colorado Association of Health Plans consortium of health insurance companies who have joined us. We have an organization that represents employee benefit consultants and brokers, the Colorado State Association. We have some other insurance agencies. We have medical providers. We have wellness providers, complementary alternative medicine providers. You'll see we have the Colorado Association of Naturopathic Physicians as members. So we are a broad-based organization who has come together to learn from each other and to go out and make a difference within the community. So obviously, when you look at our organization and who belongs, you can see that we are a multidisciplinary membership-based organization, and our goal is to lead the paradigm shift away from sick care towards wellness and health care instead of sick care. And we do promote an integrative approach within all levels of the health and wellness spectrum. We're not partial to traditional Western medicine or towards complementary alternative medicine. We have integrative practitioners. We have meditation folks. We respect all levels and all types of disciplines. So we're here to advocate and promote a multidisciplinary approach to integrative health and wellness for everybody in our state. And the reason we do that is we feel that by sitting at the table together, talking, visiting, working together, that we all learn something from one another, and we can really make a difference out there in the public and dealing with employers and educators. So our objectives with this organization are simply to educate, motivate, and inspire peoples and groups, employer groups, and so forth, to modify unhealthy behaviors and replace those behaviors with behaviors that promote improved health, wellness, and overall quality of well-being. So we are an organization that believes strongly in behavioral modification, and that without behavioral modification, we're not going to be able to improve the overall health and well-being of people in this state in the United States. We also want to be an educator. We want to educate stakeholders, policymakers, the legislature, employers, and other individuals and organizations that are interested in both health and wellness. And then we want to be able to promote health and wellness policies that are based on mutual cooperation rather than just being one-sided. The issue out there is not just specific to Colorado. It's pretty much the same in all states across the country, and that is the fact that while wellness programs, corporate wellness programs, have been very well saturated to maybe the 70% level in organizations of 75 or 100 and above because they have human resource staff, the simple fact is that most of the small businesses, specifically under 50 and perhaps as low as high as under 100, they have not gotten into wellness on a broad basis. They have not taken a look at it. They haven't implemented it. And of course, the problem is if we're going to reach the large population of this country, since 85% plus or minus of the employees work for businesses with less than 50 employees, we have to proactively figure out and motivate small business owners to take a look at wellness programs from a what's in it for their perspective. Could be premium reductions. That's one of the good way to get their attention. And of course, a lot of times they don't believe the return on investment story that a wellness program has in a group of 1,000 because it's so far from their small business of 50 or fewer. In Colorado, the state law and in some other states prohibits. It does not allow insurance carriers to reduce health insurance premiums based on an individual or small group's healthy lifestyle. So prior to the change that we were able to get passed, employers, employees, and insurance carriers could not see lower rates on their health insurance premium for participation or outcome-based wellness programs. So there was very little, if any, financial incentive for these small businesses to investigate and adopt wellness programs. So the Colorado Society for Wellness and Prevention, along with the Professional Health Insurance Agents Association, which is called the Colorado State Association of Health Underwriters, introduced Colorado House Bill 101160 in January of 2010. And very simply, this legislation does allow health insurers in Colorado, whether they're filed in Colorado from outside the state of Colorado or if they're domiciled in Colorado, simply says for those folks, or those carriers who provide coverage, health insurance coverage, that the law will allow them to give financial incentives, including actuarially appropriate reductions in health insurance premiums, for an insured's participation and outcome-based results in specific wellness programs, things such as quitting smoking, reaching a healthy weight, and so on. And the reason behind this, of course, is that everybody is complaining about the cost of health insurance, and to be honest, health insurance is expensive because the underlying cost of providing health care is expensive. So the only way that we can truly reduce cost to individuals and businesses is to improve the health of our population. So Colorado House Bill 1160 financially incentivized more individuals to take steps towards achieving a healthy lifestyle. So it's a bold step that Colorado has taken. This legislation went into effect in July of last year, 2010, and it was general fund free. It was revenue neutral to the state because it did not involve tax incentives or anything like that. So there's really no negatives to the legislation that was passed last year. There's no penalty for employers who do not want to participate. If an employee does not want to participate, there's no penalties there. And wellness programs do have to be scientifically based, and discounts must be actuarially sound and approved by the Division of Insurance. So the bill was written in such a way as to be credible. So again, it was approved by both legislative chambers within Colorado on the first attempt, which is obviously unusual to have a piece of legislation passed on first attempt. It was signed into law by Colorado Governor Ritter, has an effective date of July 1st of 10, and we are already seeing some insurance carriers that you have in front of you there that are getting on board, building their wellness programs inside their individual and small group health plans. But additionally, outside wellness programs like what you're going to hear about with U.S. Preventative Medicine can also help employers qualify for these discounts. And we are going to go into more depth about this in January 27th. If you happen to be in or around Denver, Colorado on the 27th, we would love to have you join us. If you want to send me an email, it's steve@coloradowellness.org. I can email you the information. We'll be doing a free health fair from about 10:30 in the morning till noon, and then from noon until about 2 or 2:30 we'll be doing some seminars, speakings. We've invited all 100 of the Colorado legislators, policymakers, employers of all sizes, medical and camp providers, and just basically anybody who's passionate, wellness-minded individuals. Now, this legislation will sunset in 2014 because that is when the federal health care reform bill kicks in with wellness discounts up to 30% in 2014 for employers, 30% of the typical premium or an individual's premium, and they may be able to go up to 50%. So this gives Colorado a head start on the 2014 legislation because we're already beginning to enact that. So we hope you can join us on January 27th. And one of our speakers, in fact, the keynote speaker, is going to be Dr. Loeppke. Dr. Ron and I have known each other for a few months. It's been a pleasure to work with him on some other things, and you're going to enjoy his presentation. Dr. Loeppke is Vice Chair of U.S. Preventative Medicine. and also serves on the International Advisory Board for them. He's board certified in preventative medicine, fellowship trained in occupational medicine, and the American College of Preventive Medicine. The nice thing about Dr. Loeppke is he has been involved in preventative medicine for over 20 years. I think he'll talk about that, but he was involved in preventative medicine and wellness before it was cool. So with that, I'll turn it back over to you, Dr. David, and I look forward to hearing Dr. Ron's presentation.
Well, thank you very much, Dr. Steve. You do sound like a doctor. I have to say that, right?
Until you get to know me. Thank you.
Well, we appreciate that, and we are going to hand it over to Dr. Ron right away. But for those of you who are just joining us, we just want to make a quick announcement that this is a Building Strength webinars presentation, and we will be making, for those of you who are viewing this both now and afterwards, the series called the Prevention Series available for you to access from our website, and that of course is buildingstrengthwebinars.com at the very top of the slide. And so we are again very honored to have Dr. Ron come to a presentation, and I tell you, you will be blown away and with the information that he has to share. So without much further ado, I'm handing this over to Dr. Ron. And Steve, you can start recording. I should have told you to do that before.
Okay, so thank you, Dr. David and Steve. It's a privilege to be able to spend time here today with you and share this message, and welcome everyone that's on the webinar. I know your time is valuable, and we'll try to make sure that you get some interesting information. I can tell you we're going to talk about how wellness works and prevention pays, and there is definitely power to prevention. The converging trends in our global healthcare ecosystem are clear and present, and there is definitely change on the horizon. However, we've all heard before that we cannot alter the winds of change, but we can adjust our sails and use that change to our advantage. And I think this is one of those transformational times where we can use change to our advantage. It's been said that even a legion of horses cannot hold back an idea whose time has come. And I think it's crystal clear that prevention is an idea whose time has come. Prevention can drain the floodwaters of chronic illness that is across our landscape. It also can help reduce the precursor health risk factors that lead to chronic illness. And just imagine if we could prevent some of that current burden of illness in our society and free up some of our current resources being expended on those conditions, imagine the increased availability of financial and clinical resources, the enhanced capacity of physicians and hospitals, and the strengthened safety net through our healthcare ecosystem for those in need. Therefore, I think this is not only a clinical and a fiscal imperative, but also a moral imperative. An increased emphasis on primary, secondary, and tertiary prevention would improve the health of Americans, offset some of the costs of an aging population, enhance the productivity of our nation's workforce, and sustain our nation's economy. So let's talk about the power of prevention. Coming out of the chute, I want to talk about the impact of personal health risks, health behaviors, lifestyle, in terms of the mortality risks in the United States. Over half of all the causes of death in the United States are related to lifestyle. In fact, one of my professors in my preventive medicine residency said many years ago, largely how we live dictates how we die. So even though there are other influences, and heredity is 20% of the risk of our cause of death, we can't just blame our parents for what's happening in our health conditions. In large part, many things are preventable, and you're going to see how. The other thing is I want to put this on the stage of the global situation. The World Economic Forum in Davos, Switzerland, came out with their 5th annual report, Global Risks 2010, and they pointed out that a critical global risk is the impact of chronic illness on both advanced economies as well as developing countries. That this is a silent epidemic of non-infectious diseases, obesity, diabetes, heart disease, cancer, and they require global solutions. In fact, the World Economic Forum recommends that there be new models of health financing built upon public and individual incentives for prevention, and that chronic illness is destructive and debilitating to individuals as well as nations and ultimately a threat to peace, and that the only sustainable pathway to improved health is through prevention. Now, when we look at these converging trends and this need for a culture of health, a culture of prevention, the healthcare cost crisis we face, not only in this country, but globally, in large part is driven because of a health crisis behind it. It's the increased burden of chronic illness and the increased burden of health risks leading to illness that increase the utilization and the cost in the system. The epidemiologic trends of the population, the age wave of a baby boomer generation, I coined the term as a silver tsunami that's just about to hit the beachhead of our healthcare system in terms of use of services. Yet we can hold back that tide and prevent and improve the health status and prevent those conditions from being a problem. And I've had a chance to actually interact in Capitol Hill and in some of the health reform discussions, and I've just encouraged all of the policymakers and the influencers, let's make sure we focus on the health in health reform, because that's what's going to give us sustainable cost reduction and improvements to our system. Now, the employers are asking for an integrated solution that moves upstream, that is prevention and wellness focused, that deals with the whole population, but also the whole person. And Dr. David talked earlier about this integrated mind and body and holistic approach, and that's what we're seeing to be the most effective solutions. Also, that there is a value to healthy human capital. The health of the workforce is inextricably linked to the productivity of the workforce, and therefore the health of the bottom line of businesses and enterprises across this country. And they recognize that value proposition for better health. There's also opportunities around the demand side, which is the consumer, and the supply side, which is the provider, doctors and hospitals, in promoting this culture of health. There's new initiatives that are available to align incentives for improving health and focusing and investing in prevention. Even with the accountable care organizations, patient-centered medical home, pay for performance, employer-based incentives for employees and their family members to participate. Exciting times where those incentives are aligned. And there's a lot of innovation with high-tech and high-touch decision support, wireless, Bluetooth, smartphone apps, all the types of things that are helping us change our behavior on a daily basis and promote that culture of health, not only in workplaces, but also throughout our communities, our homes, our families, our states, and our nation. So what's the problem? Well, the problem is there's this increasing burden of illness and risk that is leading to an increased burden of costs and reduced U.S. productivity in the global economy. Over 133 million Americans have one or more chronic health conditions at this point in time. 75% of all healthcare spending is on those people with one or more chronic illness. 27% of the rise in healthcare costs is associated with the increase in obesity rates. In fact, it was stated that the waistline impacts the bottom line. But the solution, which should be encouraging to all of us, is that the Center for Disease Control and Prevention has found that 80% of heart disease and diabetes, as well as 40% of cancer, are preventable if Americans just stopped smoking, ate healthy, and exercised on a regular basis. In fact, there was a study published in Journal of American Medical Association Journal that people that followed the Mediterranean or Asian diet and did not smoke and had daily physical activity and moderate alcohol use, that 1 glass of wine for women, 2 glasses of wine for men a day, that you could have this amount of reduction in the middle column of these conditions in the left column. So of heart disease, you could reduce heart disease between 64 and 83% in the U.S. if we did those lifestyle factors. You could have 60% of cancer in this particular study that was shown. You could reduce 90% of diabetes. These are compelling results that have been studied and looked at in terms of the evidence and the science that's behind it. So, the other thing is the employer community is willing to help invest in this. The stakes couldn't be higher from their perspective. They want to be able to compete on a global economy. And they're focusing, the employers are focusing on the link between the health of their workforce and the engagement, the energy, the resiliency, and the performance of their workforce, and therefore the health of the company performance. So employers are looking at their strategies to leverage the benefits of better health rather than merely just manage the cost of the health insurance benefit. Now that's a subtle difference, but it's making all the difference in the way they're wanting to invest their dollars to improve the health and well-being of their people and their families. We did a research study at the American College of Occupational and Environmental Medicine, a multi-employer study, and along with Integrated Benefits Institute and Dr. Kessler at Harvard Medical School. We analyzed over 1 million claims and over 50,000 health risk assessments among these populations. And what we found is that on average, for every dollar of medical pharmacy costs that employers pay out, they're paying $2 to $3 of health-related productivity losses. Health-related productivity losses in the form of absenteeism, where people are missing work or have short-term or long-term disability, or presenteeism, where they're present at work, but they're not as productive because of a health condition that's not well managed or health risks that are out of control. So I put this in this iceberg metaphor because this is what is, in many times, lurking beneath the waterline, the surface of what corporate America has paid attention to in the past, and therefore increases the value proposition of why they want to improve and help participate in improving the health of society, but clearly the health of their workforce. In that study, we looked at the top 10 conditions, medical conditions that cost the most money in relation to medical and pharmacy costs, and cancer is certainly on the top of the list. But when you add into these costs the absenteeism and the presenteeism, it's a totally different top 10 list of conditions. Number 1 on the list goes to depression. Number 2, obesity. Then arthritis, back neck pain, anxiety, gastroesophageal reflux disease. Look at the number of these that are behavioral health or mental health related. And that's why this connection of a holistic approach to improve the health and well-being of people is so critical. In fact, if you look at several different research studies showing the linkage between the number of health risks that people have and then how that impacts their workplace productivity loss. So the greater the number of health risks, the greater the presenteeism impact, the greater, in yellow, absenteeism, work days lost per person per year, and in red, the greater the short-term disability days per year. So this ultimate solution through prevention is to reduce the burden of risk and illness. That's the only sustainable way we're going to have cost decreases over time for a population. In terms of workplace wellness programs to accomplish that, we've seen that there needs to be a healthy company culture. That's paramount, where the senior and middle management of the company walks the walk. They don't just talk the talk, because culture eats policy for lunch every day. we've got to find ways that this is part of the seamless, integral fabric of an organization, that this is part of who they are as a company in empowering and enabling healthy individuals in an environment that supports health. Secondly, that there's strong communications and branding so people understand this isn't a program of the month club, but this is a long-term sustainable focus of the business and a way to improve performance of individuals and the company. And that there's aligned incentives, that there are assessments of the risk, both at an individual level but also at an organizational, corporate level, that it's built on evidence-based science, interventions, that the environment and the policies together do support healthy lifestyles, and that there's a consideration of the full value of what the investment in health brings, rather than just merely the financial ROI by itself in terms of medical pharmacy cost savings. And to integrate all of these initiatives, it's all based on, though, the clinical model of preventive medicine. Primary prevention is keeping the healthy people healthy. Secondary prevention is early detection, early diagnosis. Instead of waiting for their first emergency room visit or hospitalization when the symptoms break through, catch those early. And tertiary prevention, which is earlier intervention and evidence-based medicine care management that decreases complications, it decreases hospitalizations, etc. So prevention is an investment to be leveraged rather than a cost to be justified. And so that it is across the whole population, you can see on the right side of this chart, it represents that 15% of the population which really represent 85% of the total healthcare costs in the system. Those are people with chronic illness, complex care issues, even some acute self-limiting conditions. But 85% of the population that only represents 15% of the costs in the system is upstream of there. And we need to make sure we're paying attention so we can keep these people healthy and that we can identify people early so that we can intervene and bring them back from the brink of developing these conditions. The challenge is, let's face it, health is an action verb. It's an inside job. Here's this guy saying, give it to me straight, Doc. How long do I have to ignore your advice? So, unfortunately, it's something that we have to do ourselves in the way we make our decisions, the way we make our priorities, that we choose our habits, but we need help. Because otherwise, like this person, they think more of their pet, taking their pet on the walk while they're driving in the car than they do themselves. And it's obviously not an ideal approach to our personal health. So I want to talk a little bit about obesity. And when we look at body mass index, which is a measure of adult's weight in relation to his or her height, specifically the adult weight in kilograms divided by the square of his or her height in meters. When the CDC has analyzed across the United States the trends, and you can see here between 1990, 1999, and 2009, the percentages of this inexorable increase of people with really high body mass index and levels of obesity. It's alarming. I mean, look at it. The United States is even bigger in 2009 than it was back in 1990, obviously. Trying to just see if y'all are still awake and with me here, but when we're looking at this issue of obesity, how does obesity cause disease? Well, it's largely because of the intra-abdominal and the liver fat area. That's the critical fat depot, and you can see on this imaging study the white area tends to represent adipose buildup. And unfortunately, look at the dramatic increase in risk of developing diabetes as your body mass index goes up. Even moving up there to the overweight section, you can see how the relative risk of developing diabetes moves from 3 times up to 20 times, and if a person moves up in the obesity areas of body mass index and the BMI is over 35, they have a 60 times higher risk of developing diabetes. Now the reality is 57 million Americans have prediabetes. They have the risk factors, the obesity, the hypertension. They have elevated blood glucose, blood sugar. And yet out of those 57 million Americans with prediabetes, only 7% of them know that they're prediabetic. That's why we have to improve more of the primary and secondary aspects of prevention so that we can have awareness, education, and early detection and screening. But the good news is that modest weight loss drastically reduces the intra-abdominal and liver fat, as well as reduces the multiple cardiometabolic risk factors simultaneously. And so this imaging study shows this dramatic increase in the adipose tissue even after just a 10% level of weight loss. So for a 95 kilogram person moving down to 85 kilograms. So that's doable. I mean, when you're only talking about thinking that you, as a 200-pound person, could get these dramatic results after just losing 20 pounds, it doesn't mean you have to have all these other biggest loser attempts of losing 100 pounds or more to make a big difference. And what we need to realize is that there's a phenomenon scientifically called the compression of morbidity, that if we look at our health status over time and how, you know, it then deteriorates in our later stages of life, there is a certain point below which that health status line leads us to disability, and we're not able to function well, and our functional status is poor, and we have conditions that bring us in and out of the hospital. Of people that improve their health and continue to focus on their health risk factors, they find the dotted line to be what their experience will be. They can live healthier longer throughout life, and then they die more suddenly at lower cost. Now, I'm not trying to be, comical about this. This is a scientific principle, and this is encouraging to know that we can have not only more years to our life and a higher length of life, but also more life to our years. We're able to have a higher quality of life while we're alive. So, on the scenes comes our company, U.S. Preventive Medicine. We have bundled the clinical model of prevention. It's based on the scientific principles and the scientific evidence of clinical preventive medicine. I'm board certified in preventive medicine. Preventive medicine is like any other board certified specialty like cardiology or obstetrics gynecology. We have to go through the same type of rigor and training, residencies, and testing. So there is a science base there. We've implemented that into a new approach, a benefit, a prevention plan similar to a dental plan or a vision plan. It's not insurance-based, but it's a focused prevention plan that's a comprehensive solution that gives people personalized prevention plan that's high-tech, it's high-touch. We had hoped to show you some video excerpts to give you a flavor of what the prevention plan is like. There were some technology glitches here at the last minute, so instead I'm going to refer you at the end of the presentation. For any of these more detailed videos and information, you can go to uspreventivemedicine.com and be able to look at that. But our vision is to make the world a healthier place. That's what motivates us, that's what drives us, that's what each of our employees and those affiliated with our company are focused on. We have different elements of our services and products. One is the prevention plan that is largely primary and secondary prevention. So keeping healthy people healthy, and then identifying risks and detecting conditions early and helping bring people back from the brink so that those conditions are well managed quickly. We also have prevention plan care management, which is chronic condition management for those people that do have already diabetes or heart disease, heart failure, chronic obstructive pulmonary disease, other chronic conditions. We have that available, where we have nurse health coaches and can provide that type of assistance in helping people manage their conditions more effectively. We also have what we call Prevention Plan Premium. This is a concierge and executive health offering that for people that are members, we have centers of excellence where we have relationships with centers like Mayo Clinic and Scripps Clinic and Cleveland Clinic, others where as members of the prevention plan, people would be able to have a VIP referral service if needed because of certain conditions they have. We also have Prevention Plan Prime for the senior population, and we're doing pilots right now in real estate communities for retirement communities where it's actually built in as part of their membership when they buy their condo or part of the real estate, part of the retirement community, they have the prevention plan as part of that. We've also been working on the prevention plan for kids, and we think this is going to be one of the most compelling additions to our suite of products, because we all recognize that we can't just wait until we're adults to try to deal with health. In fact, we have seen the CDC come out stating that because of the obesity crisis in the children today, that they may be the first generation that don't have a longer lifespan than the generation preceding them in the history of mankind. That is a sad and telling statement if that ever comes to pass. And that's why we feel like that we're going to be trying to mobilize part of the solution and help offer a prevention plan for kids to get them engaged early with their families so that we can focus on better health. Currently, we're involved in providing prevention plan business across all 50 states and the United Kingdom. And some of the differentiators are that we have a prevention score that is very unique. I'm going to show you a slide in a little bit that kind of explains that better. But just for a moment, think of it like a credit score, but it is looking at a lot of different elements and is a prevention score that can change throughout the year as you participate and engage in health improvement. It's also independent and portable for the consumer. So if your employer pays for this prevention plan benefit and then you leave that employer, you can pick up for the next year that service and be able to carry it forward. It has personal health record and other elements to it that you're going to want to be able to keep. It's also got a world-class interactive online prevention experience, a comprehensive, engaging platform. Utilizes YouTube, iTunes, personal website, virtual coach. It's personalized and tailored based on your risk factors, your age, your gender. And we have better measurable results. And I'm going to share with you some exciting results from a research study that was published in the Journal of Population Health Management recently. It's also flexible and customizable solution for any size employer and consumer. You heard Steve Dodder talk about the need for small business to have solutions, and we agree with that, and that's one of the reasons we created it this way, to have a small business solution as well as the very largest businesses. And it has modular pricing and feature sets, flexible lab test panels that could be considered. We also have an unparalleled international advisory board of thought leaders. We have Dr. D. Eddington at University of Michigan, who some feel like is the grandfather of population health. He's done over 800 publications, peer-reviewed journal articles and books in this subject matter. He happens to be one of the co-authors and one of the co-investigators of this research study that I've told you about that I'll share with you. Dr. Pam Hymel, Global Medical Director at Disney, Dr. Bossig, Global Medical Director at Dow Chemical, and you can see Dr. Kessler at Harvard, Dr. Getzel of Emory University, and others, and Dr. Nash, who's Dean and Professor at Thomas Jefferson University School of Population Health, is the co-chair of the International Advisory Board along with myself. So the prevention plan itself has a cascade of assessment services. It also has a cascade of intervention services, a robust library of how-to videos. We have 24/7 telephonic health coaching and nurse support. We've got online education programs. We've got this prevention score that allows tracking progress and even aligning incentives and rewards that can be offered based on how you're able to participate and engage in various programs and change your score. And that's a picture, a snapshot of the prevention score. There's two dials. The dial on the left is worth 500 points, and that's the baseline assessment. The dial in the middle is another 500 points, and that's based on your participation and engagement of programs and activities to improve your health. And then the dial on the right is the combined score of your prevention score, and it can, again, be linked to rewards and incentives either by the employer or other sponsoring organizations. Now, all this is well and good, but specifically the employer community says, well, I want to know what's our ROI if we invest in these types of initiatives. And I just put this up so that we expand that concept. It's not only ROI, it's what we call VOI, the full value of the investment in prevention that needs to be measured. So yes, we need to look at the financial indicators of the net savings on medical pharmacy costs savings, but we need to look, what about the participation rates in the population? Are we increasing? The prevention screening, evidence-based guidelines, are the right people getting their mammograms, their colonoscopies, their other screening tests? Are their health risks improving? And this is the critical one. As health risks go, so go costs and so go conditions. In other words, if we can reduce health risks, it's been proven costs come down, and obviously this burden of illness of chronic conditions comes down. And what about the evidence-based clinical indicators of people that have diabetes? Are they getting their hemoglobin A1Cs on a timely basis that's recommended? Are they in the optimal range of management for the levels of hemoglobin A1C? Are people utilizing fewer emergency room visits and hospitalizations? Is their productivity improving? And ultimately, from an employer perspective, what's the shareholder value doing as we're making inroads and improving the health of the workforce? So these next few slides, I'm going to show you the measurable impact of the prevention plan on a study population across several employers. This was published, as I mentioned, in the October 2010 issue of Population Health Management. And you can see Dr. Eddington and Dr. Bay as co-authors, along with myself. When we tracked 2,600 people from across different employers that we measured at baseline, their health risk assessment, their blood pressure, their weight. We did lab tests like cholesterol, blood glucose, and then we had them participate in the prevention plan for 12 months, and we remeasured them in all of those areas of metrics. And what we found is that over that 12-month period, there was significant improvement of people moving into the low-risk category in the green bar there. Low risk means 0 to 2 health risk factors. Moderate risk in yellow means 3 or 4 health risk factors per individual. And red, high risk, means 5 or more high health risk factors per individual. And you can see that there was significant reduction in both moderate and high risk categories. In fact, when we compare them to what the natural flow would be in a population. Dr. Eddington has done studies over several million people over decades and have found in the red column on this chart what would be the natural flow of the population. And you can see that over time, and this is a one-year time frame, the natural flow would be people get higher health risk. They get less healthy. There would be more people move out of the low-risk category into the moderate and into the high.
Welcome to GoToWebinar, Web Events Made Easy.
The low risk and out of the moderate and high risk when they were on the prevention plan. And when we look at the specific health risk categories, of the people that started out high risk, so 5 or more health risk factors themselves, over 64% moved down to lower risk categories. 48% moved down to medium risk, and 15% moved down to low risk. And of the people that started out medium risk, 46% of those moved down to low risk. Now, I know it's in an afternoon, and maybe some of you are tired at this point after having a lunch, but I'm going to tell you, for an old preventive medicine physician like myself, this gets me excited to see the impact that can happen within 12 months on a population across different employers. And here we can see that of the people that started out with high blood pressure, over 42% of them moved down to normal blood pressure levels after 12 months of being on the prevention plan. Of people with elevated blood sugar, these are people that are pre-diabetic. The train is on the track. The ticket's paid for. If they don't do anything else, they will develop diabetes at some point. 31% of those people came back from the brink and were able to come down to normal blood glucose levels after 12 months of being on the prevention plan. And you can see on down the impact on cholesterol reduction and the fatty diet, the physical activity improvement. These are compelling results and highly statistically significant, as you can see from the research study. And what Dr. Eddington has shown is for every individual person that reduces an individual health risk, and typically we're looking at 15 or more risk factors per person, and when I was showing you those categories, the high-risk people were people that had 5 or more risk factors. If you can just reduce one of the risk factors, in Dr. Eddington's research, it showed that it was worth $215 of average medical cost savings to the individual. And for each individual health risk reduced per person per year, it was worth $950 of average productivity savings to the employer. And this study was a Harvard study looking at the literature published in Health Affairs and showed that for every dollar invested in these types of comprehensive wellness programs, there were $6 saved. $3.27 on medical pharmacy savings, $2.73 on absenteeism savings. So 6-to-1 ROI. And this is a case study that I was actually able to do. It was with a publicly held company, 58,000 employees, and we looked at a model showing that they had 8 days per employee per year of health-related productivity loss. And the chief financial officer said, what would it be worth if we could get back 1 out of those 8 days currently lost to health-related productivity loss? In their instance, that would be worth $18.8 million to their bottom line, their EBITDA, to get 1 day of productivity back per employee per year. They traded at a 13-time multiple on Wall Street, and so that translated into a $244 million estimated market cap increase if they could get 1 day per employee per year across those 58,000 employees. They had 292 million shares outstanding, so that translated into 84 cents in additional per share value to get back 1 day per employee per year out of the current 8 days lost due to health-related issues. That makes a compelling business case for the corporate community, because then they can begin to connect the dots and see how the health of their workforce is inextricably linked to the productivity of their workforce and the health of their bottom line. Another study from the National Business Group on Health and Watson Wyatt showed they looked at 355 large employers, and they found of employers that had highly effective health and productivity improvement programs, these comprehensive wellness prevention programs in place, that they yielded 20% more revenue per employee, demonstrated 16% higher market value, and 57% higher shareholder returns as companies compared to those companies that did not have these types of prevention and wellness programs in place. In fact, the Milken study showed that if we put primary, secondary, and tertiary prevention in place, it could have a cumulative economic impact of over $1 trillion annually in America. Now, I know most of us may have a hard time getting our head around what a trillion is, but let me give it to you in terms of seconds. 1 million seconds is 12.5 days. 1 billion seconds is 32.5 years. 1 trillion seconds is 32,500 years. And when we talk about this amount of potential annual savings by implementing primary, secondary, and tertiary prevention, just based on what we know today, that's something that we have to take seriously and realize that good health is good business from the exam room to the boardroom, and that we're on the threshold of a monumental transformation from our sick care system to a true health system. But make no mistake, this is a battle for better health against the unrelenting enemies of destructive health risks and disabling disease. Waging this battle requires inspired vision and focused commitment from all of us. We have the opportunity to harness our intellectual capital.
Welcome to GoToWebinar, Web Events Made Easy.
As the data that allow us to define a compelling business case. We can delineate the tools to use, and we can determine an action agenda to implement. But I would submit that we will win these battles for better health that we face, not by better definition, delineation, and determination, but rather by personal decisions and actions on the battlefields of our daily lives. It's not what we know, it's what we do that will make the difference and write the chapters of our life. I would submit that the tectonic plates are shifting, and we are on the threshold of witnessing the transformation of our system beyond being reactive, illness-oriented sick care system to becoming more proactive, wellness-oriented healthcare system, a true health system built on the pillars of prevention. Thank you very much, and I'll turn it back to you, Dr. David.
Well, thank you very much, Dr. Ron. Like I mentioned earlier, this is nothing short of amazing. Thank you so much for the time and the effort and the thoughts that you put into this. And I know in the years and decades to come, the United States as well as countries around the world would benefit tremendously from this plan. For those of you just joining us, I hope you haven't missed much, but this has been an awesome presentation by Dr. Ron, who is the Vice Chairman of the U.S. Preventative Medicine. His website, I believe, is uspreventiveMedicine.com, and I'm not sure if he mentioned this, but the world's largest company, Walmart, yes, it is bigger than ExxonMobil now, has signed up with this company to provide this plan to their members. So this is not just a fly-by-night. I mean, anyone who has watched this presentation would have arrived at that conclusion on his or her own. We're going to open it up for questions now. So if you have questions, there should be a chat box at the top right of your screen, and you can go ahead and type in your questions. Of course, if you're watching a presentation or a video of this, you can either send the questions to us, and we'll be sure to forward them to Dr. Ron and of course Steve Dodder, who did an earlier presentation. But we will certainly want to help where that is concerned. As I mentioned at the beginning, our goal is to give you the best information out there on health, strength, and human effectiveness. And this is a testament to that. We shall continually strive to provide better and better information for you, because people need to be educated, and that is our focus. Education, education, education. It is when people know about how their minds and their bodies work, and they know about the threats that are out there. They know about what is available to them, sort of like with what Dr. Ron has mentioned. The tools, the resources. U.S. preventive medicine is one of them. When people know that these are available, then they will be better equipped. They'll be empowered to take control of their health. And as I mentioned a couple of times during this presentation, we have made this series available for you. It will be available probably on our site in about an hour or two. I think Sherry's working on that right now. But we have looked at the most important health concerns: heart disease, strokes, cancer, dental health. Very few people realize the importance of dental health. And yes, dental health, or the lack of it, has been connected to strokes, to cancers, and to heart disease. Believe it or not, some people say as much as 80% can be traced back to your teeth. So it is very, very important that you address all this. And again, this will be available on our site, and you can go to our site, which is buildingstrengthwebinars.com. Oops. And let's see what else we have here. Okay. All right. Well, let's see what questions we have. Steve, did you have anything you wanted to mention?
No, I'm doing fine, thank you.
Okay. Oh, thank you.
Just thank you for allowing me to participate today. I hope it was helpful.
Well, we appreciate it as well. We appreciate it as well. Okay. Question. This is Dr. Sami saying, what a great plan. Doesn't this presentation put it all together? This is what many of us have been working towards for many years. Thank you, thank you, thank you, Dr. Loeppke. Right, Dr. Sami.
Thank you. Thank you for participating. And obviously, like I was saying, this is transformational times that we live in. And I think it's going to require all of us pulling on the oars together as best we can, and really getting focused on how to improve health, because otherwise the trends are devastating when we see where they're headed if we don't turn back that tide. So we appreciate everybody's involvement, and anybody that has more interest, like I said earlier, and Dr. David mentioned, feel free to go to our website, uspreventivemedicine.com. You can also access it by going thepreventionplan.com, either one, and they'll be able to show you various other resources, papers, evidence-based scientific information, the tools that we have available. The actual prevention plans show a demonstration of it, and also, as Dr. David mentioned, how to even potentially buy it today across Sam's Club on their online samsclub.com website as well. So all sorts of options, but we appreciate everybody's interest.
Absolutely. And I know the focus now is on group organizations and larger companies, but this is available to individuals as well, right, Doc?
That's correct. They can actually go on our website and get it for themselves, or, as I said, through the Sam's Club online, samsclub.com, and be able to get their personalized prevention plan that way.
Right, right. And someone is asking, can we get a copy of the iceberg? That was a good iceberg.
Yeah, you know, it actually is something that's about to sink a lot of corporate ships if they don't pay attention to what's lurking beneath the waterline with all this cost. And certainly they can get a copy. I don't know what your policy is, Dr. David. I'll leave it to you as to how you share slides and contents that come across your webinar.
Do you give us permission to make handouts of them?
Yes. Well, let me just make sure I don't have anything in there, you know, and maybe just take a look at that before we do. But certainly we'll make that available in some form, and it'll certainly include the iceberg.
Okay, great. Well, I'll just wait for a yay or nay from you on that, and then we'll let people know whether or not it will be available.
Okay.
Okay. Well, excellent. There don't seem to be too many questions. This has been this is not a busy time of the day. Obviously, this is a busy time of the day, obviously. So not. I'm sure for the recording will be available both on our site and on the U.S. Preventive Medicine site. So if you have friends and family or your boss or your employers you would like to view this, just go to any of these two sites. It will be available for free for a limited time. So be sure to alert people of that fact. This has been great. I'm going to wrap it up now. Doc, Steve, any final words for us?
The last thing I would just like to say is that, if we collaborate and work together as individuals, and if we come together, we can make a difference. We can solve the problems, and we can make this country a healthier place, a happier place for people to live in.
Absolutely.
I agree. And thank you for the opportunity being part of this webinar for Dr. David and Steve. And let's together try to make the world a healthier place.
Absolutely. Absolutely. Thank you very much, everyone, and we'll call it a day. God bless.
Mm-hmm.